Hi everyone, my name is Claire Carmichael and I'm a registered nurse who's really passionate about creating change for our transgender patients. I was a newly qualified nurse in January 2020 and I went straight into general practice to be a general practice nurse, and I didn't really think about transgender healthcare as such. I'd never had that training at university. I've never had any training ever actually on transgender patients and their needs and hormone treatments and things like that. Until I was sat in my clinic one day and I was faced with a transgender patient and I was giving them the testosterone shot. And I sat there and I thought, wow, I don't know what I'm giving. I don't know what dose I'm supposed to be giving. Obviously, we have the prescriptions and things that tell us. I don't know the effects on the body of this medication. I've never had training on transgender patients and I wanted to know more. I wanted that training so that I could give the best care possible to the patient that's in front of me, so that I didn't cause harm, that I didn't discriminate by accident, that I wasn't doing things that I shouldn't be doing. I wanted to give this patient the best care possible. So I went to the GP partner at the time and I said to them, listen, I've got this patient. I really want to gain more knowledge. I want more education around it so that I can give the best care possible to my patient. And I said, I need some more training. So have you got any pointers? Have you got any training packages? Is there anything out there that you know of? And I was just directed to a standard LGBT webinar. It's not what I needed. It's not really what I asked for. I wanted transgender patients specifically. And doing my own research out there, there is nothing, absolutely nothing. There's training if you work in the gender identity clinics, but that's specifically for those nurses and doctors that work there. There's nothing across the board within the NHS that I can see on transgender healthcare. So I went out there and did my own research. I've done days, hours, weeks, months. Like, this has been ongoing for the last 2 years. I've been researching transgender healthcare, the evidence-based practice, the guidelines around it. I took to social media back then, like 18 months plus ago, to speak to transgender people, to speak to the patients themselves, because who better to speak to than the person themselves? It's what we do with conditions. It's how, we do our research and our evidence to be able to practice as nurses and doctors. So I wanted to get that insight from people. I also arranged a day with the London Transgender Clinic. I went and spent the day with their nurses and spoke to their patients. I saw everything that they do and I was just blown away by the care that they received from these nurses. They were so knowledgeable. It was amazing. And I think many people think that private services like this for transgender patients are just people that are down a back alley that don't know what they're doing. The London Transgender Clinic in specifically, and Gender GP actually, I know there's a lot of news about them at the minute. However, I've also had meetings with Dr. Helen Webley to gain more insight into this. Both these people, they are registered healthcare professionals, they are nurse prescribers, they are amazing at their jobs. The London Transgender Clinic especially, these people, the Mary who runs the show there, she was a GP nurse and she's so passionate about transgender healthcare, and they work with endocrine specialists, like one of the top specialists in the NHS in London. They are working with psychologists, they are working with all these healthcare professionals to get the evidence to be able to treat their patients. However, something that I noticed, every single patient that I saw that day all said that their GPs were refusing to share the care. So once they've gone private to get the hormone prescriptions and things like that, they're going back to the GP, who should really be sharing the care with services to provide this on the NHS, because it is an NHS service. We have the GICs, but those needs aren't being met. The doctors have said to them, sorry, I don't understand your condition, I don't understand what these for, and they're just writing them off. This is not fair. This is discrimination in a way. And I say that because I had a 14-year-old boy, not transgender, but he was prescribed some testosterone for a rare condition by an endocrine consultant at a hospital. GP took that on, prescribed the hormone treatments, no problem at all, when this was a rare condition that they didn't understand. However, if that was patient that was transgender, it would be a different story. Would they prescribe those medications still? And this is why I'm saying, I don't want to say that people are actively discriminating against transgender patients within the NHS. However, it is out there and it is happening because people aren't sharing the care. People are just fobbing people off because they don't understand what these prescriptions are for. They don't understand the hormones. They don't understand, because There's no training, there's no awareness. And we need that within our NHS. We need more. And this is why I did my own research. I've worked with Eva, who is absolutely amazing. She's the best activist and just the most knowledgeable person on everything. I worked with her to sort of set up a webinar to deliver to healthcare professionals, which I'm doing currently now. I've had offers from universities to provide them with these webinars, which has just been amazing and a massive start. And this is what we need. We need this rolled out to all NHS services, primary care, doctors, nurses, everyone who will listen, because we need that education, we need that training to give the best care possible to transgender patients. This can't be happening anymore. It's 2022, things have changed, times are changing, and the education needs to be out there to stop discrimination happening, to stop, the care being affected of these patients. I'm sorry, I did go off a little bit on that one, but I'm just so passionate, and the more research I do, the more guidelines I see. There's so many guidelines out there. NHS have provided their own guidelines, Endocrine Society have provided guidelines on hormone treatments, best practice, treatment, aftercare as well, monitoring and management of transgender patients and hormones and things. There's so much out there that people aren't using, and I don't know why, and I don't know why people aren't doing their own research, but definitely more education and training needs to happen, because it's really sad to hear the amount of stories and the amount of things that people are saying, that they're not getting the best practice from our NHS. And that really worries me, because our NHS should be the best in the world, and it should be given the same level of care to everybody, regardless of their sexuality, race, disability, gender. We should be all treated the same. And thank you so much for listening, and I really hope that today is the start of some positive change for our transgender patients.